Hello, Facebook. Is this going to work? Hello, YouTube. My name is Jill Osborne. I am the president and founder of the Interstitial Cystitis Network. We're trying to do a live support group meeting. Facebook is being very, very weird. Hi, guys. Thank you. Yeah, Facebook is just generating error after error after error today. And I do not understand what is going on. That last one was a total bust. I swear I'm going to try it one more time. AUA is happening right now. The Interstitial Cystitis IC meeting class happened at 7 a.m. Eastern time. Stacy Shannon, our ICN representative, was there. I've already got the class syllabus. And I was going to go over stuff like that. Live IC. I'm trying with Facebook one more time. I do not. The Facebook screen just goes black. Hold on. It's one of those days. My neighbor's cat showed up really sick. I had to call him to come get his cat, take him to the vet. It's like I'm a total animal empath. Stuff like that really upsets me. So it's been quite a morning. All right. We're starting up Facebook. Hello, Facebook. I don't know if this is working. It went black. Son of a gun. Hold on. Going to computer number 2. I'm just curious here. You guys, thank you for your patience. I don't know what the hell's going on with Facebook right now. But it appears to be doomed. All right, so here, I'm going to try out this computer. Sorry. So anyway, this neighbor's cat shows up bloody like an hour ago. I called the neighbor going, what the hell? And it was a reaction to a flea medicine, Cheriston. Please don't use that. Killed my cat last year, 2 years ago. And so for those of you here for the IC support group meeting, please be patient. Facebook is not cooperating. And I'm trying to get our Facebook feed up. I don't even know. Oh my God. Sometimes the Lord works in mysterious ways. Let's see if this one works. No. You're gonna see me have I'm gonna try not to have a meltdown here. Okay, that one didn't work. Really? Holy moly. You know what? This is kind of like yesterday on Facebook when the volcano blew up. I mean on Fortnite. I'm a Fortnite fan person. And I love playing Fortnite. And yesterday the volcano blew up. I feel like Facebook is blowing up right now. Okay. Oh, yeah. And now there, okay, there's no light there either. The view is terrible. You can see my messy desk. Holy moly. Okay. I don't know if this is going to work. Okay. I'm going to, see, that's even worse. Okay. All right. Oh, what the hell? We're just going to give it a try. Okay. All right. Okay. We're starting it on Facebook. Please, God. Hello, my name is Jill Osborne. I am the president and founder of the Interstitial Cystitis Network. I'm now looking at 2 freaking oh, it went black. Oh my God. Okay. I'm done. I don't know what the hell's going on with Facebook, but I'm just going to put a note on there telling people to come over to YouTube. Oh my God. This is hysterical. Isabella's asking about cyclosporin B. I'm going to tell you, cyclosporin B is getting really, really strong reviews. There's, I think, a new research study that I was going to go over about it. It's working very well as an IC, here, hold on a sec. As a step 5 treatment intervention. It was just suggested to another IC patient that I was working with, and aside from making you a little bit more vulnerable to other stuff like cold, you got to stay away from stuff. Yeah, thank you, Lisa. It is a Facebook. All right, guys. Facebook's live streaming is broken today. If you want to watch the meeting, let's see, if you want to watch our support group meeting today, please come on over to our YouTube channel. HTTPS www.youtube.com/ICNGill. Yes, please. Is that going to work? All right. I'm done with Facebook. Screw it. Now, remember the book. Okay, hold here. I got to get stuff straightened out here. Okay. All right. Remember the book When It Hurts Down There, and it says one of a really, really good way to cope with pain for the first time is to sweat and to curse. There's to curse. So you just saw me cursing a little bit. So I'm sorry about that. But that is life, and it's just one of those days when you have a neighbor cat show up at your house bloody, and you're getting ready for your live stream, and you have to stop everything you're doing to go fix that cat. Yeah, that's how my day has gone so far. Thank you, Donna. Thank you, Lisa. Thank you, guys. Thank you very, very, very much. This video is going to need a little bit of editing, I think. All right. So anyway, Isabella was asking about cyclosporin. And actually, before we get there, let me just introduce myself. My name is Jill Osborne. Normally, I'm much more organized and successful on the internet, except for today. And so this is a live support group meeting. We do them 2 times a month on scheduled. On the first and the third Sunday. The next meeting in 2 weeks. So I'm going to do on a Saturday rather than a Sunday because we have a bridal shower to go to. My goal here is to make you so strong, so knowledgeable, and so informed that you can kick butt, that nobody can mess with you, that nobody will tell you that IC is all in your head, that nobody can minimize you or diminish you in any way. And the way we do that is with knowledge and with power. I mean, the reality here is that if anybody told me that IC was all in my head, I'd kick him in the balls. Well, you know what I mean. I mean, not purposely. not purposely, but I would do it verbally. This is going to be a hysterical meeting today. I am in a mood. I apologize, but it is what it is. So, if anybody had the audacity to tell me that IC was all in my head, I would kick them in the what, but I would do it with knowledge, information, education. And that's one of my goals for these meetings is to give you that same knowledge. Holy moly. Anyway, I do it in 3 sections. I do information, then I take your questions, and then I do a free giveaway. At this point in time, I should just give away my computer. What the hell? Then we might call this a dark stream. A dark stream is where you curse a little bit. I might end up cursing a little bit. I'm sorry. Okay. So what I wanted to do is I wanted to go over some of the research that's being presented at AUA. Of course, I rebooted my computer. It was all set up, and now I don't. Here it is. Let me open this real quick. Open this with preview, and then I actually have the actual course that was taught on IC this morning in Chicago at the American Urology Association meeting. So yeah, I'm wicked prepared. All right, let me open this up here. Alrighty then. So, and hi Julianne from Florida. Hi Kay. Hi Lisa. Hi Donna again. Hi Sherry. Hi One for the Cause. Nice to see you. Hi Angie. And this is absolutely. If this were a recording, I would be a lunatic right now. It absolutely is live. Alrighty. Okay. So I wanted to just take a little bit of moment and give you a preview of some of the research studies that were presented yesterday at the American Urology Association meeting. Now, the American Urology Association is, in fact, the biggest IC conference in the world. It's the biggest urology conference in the world, too. We are very blessed that they also have dedicated sections specifically for interstitial cystitis and bladder pain. And the research that they present, it tends to be extremely cutting edge, but also a little controversial. There's one extremely annoying, frustrating study that was presented today. But let me just some of them are arcane. We don't need to go over them. I can tell you that they released a brand new urinary tract UTI guidelines for the treatment of a urinary tract infection. I'll give you more info on that. I don't have that yet. Some of these studies are kind of like, really, you spent money on that? We already know that. But they like to scientists like to dot their I's and cross their T's with respect to research. And so here's one. This is poster session 3906, lower urinary tract disease prevention strategies recommended on social media platforms. And what they did is they conducted a large analysis of anonymous online posts about pelvic organ prolapse, stress urinary incontinence, overactive bladder, UTI, and interstitial cystitis. And what do you think their results were? They were not good. And so what they found was of the 1,000 posts that they studied, 70% had no evidence or proof that they were helpful. So for UTI, 29% of the suggestions that were given on social media had no support, but they were kind of obvious, like changing your diet. Changing your diet for UTI doesn't make any sense unless you're worried about urinary tract infection coming from food, because we certainly do know that urinary tract infection is now coming from pork. This was a very interesting thing that happened in China, I'm going to say 8 or 9 years ago, where they found the dreaded superbug the bacteria that was resistant to all known antibiotics, and it affected a small population of people around a pig farm, where in China, China apparently is the largest producer of pigs and consumer of pigs in the world. And people started getting this terrible infection. And what they ended up finding is that it was drug resistant and it came from this farm. This infection then spread to Europe. It spread across the continent to Europe. And then a couple years ago, it arrived in the United States. And it arrived in the form of a bladder infection in a woman who had not traveled. And she was in, I'm going to say, like Philly area, somewhere in there, somewhere on the East Coast. And as they were studying this very, very severe bladder infection, what they found was that it was identical to the original infection found in China. So the question is, how could she possibly have gotten it if she'd never been to China? And she hadn't traveled at all. And subsequent testing found this exact superbug in pork farms on the East Coast. So with this study, somebody said, change your diet for urinary tract infection. And normally that wouldn't make sense, except now it does. Now we know that a number of infections are arriving from food. It's important to understand that for those of us who are older, we were always told bladder infections came from poor hygiene. And inevitably, you got the ridiculous lecture of wiping from front to back, right? Now we know obviously that makes sense. But now we know that quite a few bladder infections actually can come from food. So anyway, in this study, they were showing that people were giving lots and lots of suggestions that were kind of silly. So as an example, one of the things they thought didn't make any sense was for people with incontinence to use nutmeg. Anyway, IC had the highest number of prevention strategies, and most were non-evidence-based or low, 89%. Including the use of supplements. However, we do know that they made a mistake here because we do know that supplements do have research behind them. So you kind of have to understand that mainstream medicine doesn't really like social media at all. And there are parts of social media that I really struggle with too. That's why I do these meetings. And whenever you're online, you've really got a credibility check what people are saying. I always say, listen, if money is tight, don't waste your money on a supplement that's untested. If you've only got $50 extra a month to spend, at least do it with something that has research behind it showing that it's helpful with interstitial cystitis, like Desert Harvest Aloe or Sister Protect, something like that, right? Okay, so that was one study. Another study basically found that patients who had, so we know we have our subtypes for IC, these variants for IC, and we know that there's a small population of patients who have multiple pain conditions, IC, vulvodynia, irritable bowel, fibromyalgia, pain in their shoulder, pain in their hip, whatever. Here's a study that looked at the most commonly reported body sites of pain in patients with urologic chronic pelvic pain. And what they found was most patients had pelvic pain, 85%, lower back pain, 39%, lower abdominal pain, 33%, front of the head, 27%, back of the neck, 22%. I think that's interesting. Here's a new word for you, ubiquitination. It's a study that found Hunner's lesions have alteration in ubiquitination pathways. I do not know what that is. I will research that and get back to you on that. There's a very, very good and important study here comparing typical urinalysis with next generation urine testing. And it showed that next generation urine testing provides more accurate data for determining the origins of a UTI. It is superior to simple urine cultures in terms of pathogen detection. And it is a highly sensitive tool that can detect a few pathogens in every urine sample. However, sometimes it's unclear because you're not sure if that is a good bacteria or a bad bacteria. But this is the future, my friends. This is the future. Typical urine tests are going to be changing. We're all moving now to next generation urine testing, especially for patients who have long-term, consistent, chronic urinary symptoms, frequency, urgency, pressure, pain. You got to remember that the bladder doesn't necessarily just have a bacterial infection, it can have a fungal infection. And that is what the big MAP research network funded by the National Institutes of Health found in IC patients having flares, is that many of us, myself included, actually have candida infections. I have one right now. We've been treating it for about 6 weeks. It is a beast. It is so frustrating. The last drug-resistant candida infection I had was probably 15 years ago from taking amoxicillin, Augmentin. It took me 2 years to kill it. 2 years to kill it. And the one thing I know, whenever you have yeast infection, don't do any dairy. Anytime I ate dairy, it flared. And that's with this one too. I'm not eating any dairy right now. All right. Here's the study which really deeply concerns me, so much so that I emailed our medical board, who actually are attending AUA right now, to express my keen displeasure on your behalf. I will tell you that one of them emailed me back and said, I completely agree. So because of this ridiculous opiate crisis, and by the way, did you see a couple of days ago that the CEO of one of the companies that makes Insys was found guilty by a jury? Hallelujah, you son of a bitch! How dare you tell doctors that these medications were not addictive when they were? I'm working with an Insys patient right now who I've known for a long time, and she's off of the Insys, and it almost killed her, right? These synthetic opiates are terrible. Did you all see the 60 Minutes episode 2 weeks ago where most of it's coming from China anyway? 95% of the whole problem is driven by synthetics from China that were legally sold in the United States. You could order them online. It's crazy. Okay, and guys, for those of you coming in late, you got to know I've had a morning. I'm doing a little dark mode stream today. It's gonna be a little bit of cussing today. I'm sorry. Okay, so anyway, as part of the opiate crisis, what we have seen are researchers kind of developing cases with different diseases to show how much opiates people are using. And they're using it kind of as an argument to justify cutting back opiate medications. And I'm going to say that they did it with IC. This study was presented. It's MP 47-08, opioid prescription use in patients with interstitial cystitis. I want to slug somebody right now. A total of almost 7,000 patients were identified and were associated with about 32,000 claims for opioid medication. Mean patient age was 48.6. 27% of patients had at least one opioid prescription, with a median of 2 prescriptions. 10% had more than 10 prescriptions for opiates. The most common prescriptions were hydrocodone. Hello. Oxycodone. Yeah, not so good. Tramadol. Hello. Come on. Tramadol, also known as Ultram, a very, very benign opiate. In addition, prescriptions for methadone were 1.2%. So they say there's a decline in opioid prescriptions per month for IC. However, the rate of narcotic prescriptions remains stable. Their conclusion is a significant number of patients with an IC diagnosis are treated with opioids, with the percentage receiving a large number. While the overall number prescriptions appears to be declining, the prescription rate per IC diagnosis has not declined. As part of the initiative to reduce narcotics use, our data suggests that IC treatment strategies should be re-examined. As I said to my medical board, please, God, don't let this create a foundation for readjusting the AUA treatment guidelines to exclude the use of opiate medication. And Robert Evans agreed with me. Okay, listen, Bladder pain is organ pain. It is not the pain that you get when you have a cut on your hand. When you have a cut on your hand, I actually wish I did yesterday. I have a cut on my leg. Yeah, it's going to hurt for a couple hours, but then life goes on and you got other painful stimuli. The challenge with bladder pain, it uses a different part of the spinal cord. It goes to a different part of the brain. It's associated with the limbic system. If you ever notice that you just start crying spontaneously and you don't know why, that is because the pain nerve is triggering that crying center. You're really not crying on purpose. It's just nerve stimulation, right? In research studies, IC pain is rated equivalent to terminal cancer pain. And I've lived it, and some of you are living it. I know what it's like to be up all night, crying your eyes out, laying on your living room floor, begging for someone to help you, which I did for a year before I got pain medicine. And that pain medicine, that opiate, that short-acting Vicodin that only lasts 4 hours in my bloodstream, saved my life. Because it showed me they could turn this off. It showed me that I did not have to suffer. And this is infuriating that there would be a suggestion here about changing the IC treatment strategies. I hope it doesn't happen. I don't think it's going to happen. I will fight tooth and nail for you. Because I'm not just fighting for you, I'm fighting for me. I got a prescription of Norco in my bedroom right now. Now, do I use it every day? Hell no, I don't need to use it every way. I am better. I only need to use it a little tiny bit, maybe once every 6 weeks or once every 3 months when I do something stupid that hurts me, right? So IC Awareness Month is a time when we get to tell our stories and why this is so important. Now, the good news is that the Center for Disease Control and the FDA, they have issued alerts now. They all now understand the consequences of what they have done with their guidelines. They understand that patients who were functioning normally, who were able to work, who were able to live their life with a little bit of pain medicine, when they took them off of their pain medicine, what the hell do you think happened? They had to stop working and they went back on disability. And some of them are in very, very dire straits now. The tide is changing, but we're going to make it happen together. I am not ashamed to say that I have used pain medicine. I am alive because I use pain medicine. And I really, really, really need your voice to support this. The American Urology Association supports the use of opiate medication along with a multimodal treatment strategy. What does that mean? Not only are we going to treat the pain, we need to figure out the source of the pain. We need to figure out what's hurting, because when we figure out what's hurting, we can treat that. 90% of the time when a patient calls me sobbing, it's because they have an untreated Hunner's lesion. It's like, let's get it treated. When we get it treated, the pain usually goes away, for God's sake, so you don't have to use pain meds. But anyway, when I read this 2 weeks ago, I was really pissed off. Okay, deep breath. It's been a day. Okay. Let's go to the next one. Next study, MP47-09, comorbid conditions in a nationwide heterogeneous population of veterans with IC. Let's see what they found. So in other words, what are some of the other related conditions that some of us have? Let's see here. This is one of those super, super, super like nerdy, very, very nerdy abstracts. So I've got to interpret that for you. 41% of IC patients were diagnosed with non-urologic pain syndromes like fibromyalgia. IC patients were nearly twice as likely to have a sexual trauma diagnosis, which makes sense because of pelvic floor injury. IC patients were 1.4 times more likely to have a post-traumatic stress disorder diagnosis, PTSD. And I will tell you, I work with a lot of PTSD patients. So the conclusion is a significant percentage of IC patients were diagnosed with other pain disorders. Our PTSD findings in 40% of IC patients supports the findings of one of the few studies to examine the relationship between PTSD and IC, which reported a 42% prevalence. Okay. So I'm curious, anybody out there have PTSD? PTSD, I mean, you don't have to say why you have PTSD, but I certainly have some PTSD about going to the doctor. I had a hydrodistension without any anesthesia by a radiologist who refused to read the notes from my urologist. I got her fired for what she did to me. Do I have PTSD about going to radiology? Oh yeah. Oh yeah. So if you got post-traumatic stress disorder, you are not alone with that, whether it was from something that happened in your childhood or some sort of trauma or a major accident or anything like that. PTSD now appears to be very, very strongly correlated to some of this. The question is why? And I think that what we're kind of seeing over time now is that for those of us with IC subtype 5, for those of us who have a lot of related conditions to IC, our neurological system is at play, central sensitization. And they're really now starting to look at how trauma affects our nervous system, childhood trauma in particular. And so if you've been traumatized to the point that you have PTSD, the question is, would that be affecting your nervous system in some way? And I think the answer is, yeah. I mean, we know stress is bad. We know stress intensifies pain. We know stress has all sorts of reactions in our body and in our brains. And so that's a kind of interesting study. Here's a study from India that doesn't make any sense to me. This is he was talking about cyclosporin A as a treatment for intractable IC, which somebody just asked about in our chat when we first got on. And so he is using a similar medication called tacrolimus, which they dissolved in DMSO, and then they dissolved it in water. But then he said something about how dangerous it is. Tacrolimus is a calcinerin inhibitor, as cyclosporin A is, and is very toxic. So you're using a very toxic medication as a treatment for IC? I don't know. I don't get that. Anyway, this is in India. And they found when they dissolved a tiny amount in water that it was absorbed in the blood through the mucosa and was safe and effective, and that it had a long-term response. I don't know about that. I don't think you're ever going to see that in the United States. Here is the exciting study, and this is the PEA study. We've been talking about this. We've got this new supplement coming out called Bladder Builder. It's the first supplement, and I will have it on Wednesday. Hallelujah. Woohoo! Wednesday. It's supposed to arrive in a refrigerated truck. PEA, also known as palmitoethanolamide, has been available for more than a decade in Europe. And it has been found to be a cannabinoid receptor. They call it cannabimimetic. Cannabinoid, think medical marijuana, CBD oil, whereas the bladder has cannabinoid receptors in it, and if we trigger those receptors, we can reduce discomfort. This PEA is not medical marijuana. It's a different molecule, but it binds to the same receptor and has been found to reduce pain in many, many conditions. So here we have a study from Italy of 23 patients affected by IC who were not responding to other therapies, and they underwent treatment with PEA. And the results were fabulous, absolutely fabulous. So here we go. So of this group of 23 patients, 35% had bladder pain and burning, 30% had urethral pain, 18% had painful sex, 13% had rectal burning, 4.3% had prostate burning, and 12 cases had urgency, 5 with urgency incontinence. At 3 months follow-up, 87% had a significant reduction in pain intensity. Urgency persisted, however, in those. At 6 months follow-up, pain significantly decreased in 75% of patients, and it completely disappeared in some patients with no side effects recorded. No side effects recorded, my friends. They think it's working because it downregulates mast cell degranulation. So, the new Bladder Builder supplement that's coming out will be the first supplement in the United States to contain PEA. It's going to have chondroitin in it for a bladder coating effect, quercetin in it for the antihistaminic effect. It's got a few vitamins in it. It's got a few minerals in it. It's got a few probiotics in it, and there's a reason for all of those that we will be explaining when we do the product launch. But most importantly, it's got the PEA in it, and that's really, really exciting, especially for those patients who do not have access to traditional pain care. All right, and the rest of these, pudendal neuromodulation. Here's an interesting study. What they found, this was using next generation testing. They were trying to make a case that the biome in IC patients was different in the urinary biome, bladder biome was different in IC patients versus non-IC patients. And they found that our biome was not significantly different. Research study on bladder removal, which is only used by a tiny, tiny percent of patients. What they found was for these patients, that bladder removal improved their pain and their quality of life. However, sexual function, because you've got equipment down there, is a little bit affected. Acupuncture is an acupuncture study which found that acupuncture improved with pain, pelvic floor tenderness, with continuing effects that lasting 12 weeks post treatment. So if you have acupuncture available, that would be something interesting. A lot of these are really, really nerdy. There's another one I think that's really important. Patients with pelvic pain demonstrate greater catastrophization as the number of pain comorbidities increase. So what does that mean? What that means is when you're in pain, you get scared. When you have a flare, how many of you go, oh my God, well, is this the one that never goes away? Will I always have this pain? Will I always live with this pain? That's what you call catastrophization. And the answer is that to a great degree, that is a fairly normal response to being sick and having an injury and having pain. It's reasonable to be anxious about it. What is not reasonable is what we call a kind of continuous catastrophization, where your daily thoughts become consumed with this. And before you know it, you're catastrophizing about everything. It's like, oh my God, am I going to lose my job? Oh my God, will I never be able to work again? Oh my God, is my husband going to leave me? Oh my God, this. Oh my God, that. Oh my God, that. And you end up kind of like a twist. I tell patients that I'm talking to who are like that, it's like they're a tornado stuck in their anxiety. And it's really important that you stop yourself. You will make yourself crazy if you are catastrophizing every couple minutes. I used to do it too. Again, it's what happens. But when you start dwelling on it, when every thought becomes negative, when every thought becomes fearful, that's when it's too much, and it's going to change your health, and it's going to change your outlook on life. Ultimately, in the end, we are not God. I am not God. You are not God. You cannot predict the future. You should not be saying, I'm never going to get better. The only thing you have control of right now is right now, this moment. What can you do right now to help your bladder? What can you do right now to improve your state of mind? What can you do right now to calm and soothe your body? If you sit here and you worry incessantly about everything in the future, you're getting so much adrenaline going through your bloodstream, it is ridiculous. The more adrenaline you have, the more your heart races, the more upset you get, the more your stomach gets upset. It's very, very important that we stop that adrenaline, that we stop that catastrophizing, that we stop that anxiety so that you're not having all the adverse effects which happen when you live with anxiety. And so let me give you my tip. This is what I do. When I have a negative thought, I close my eyes and I visualize a red stop sign. Just stop. I just stop for a moment. Just stop my brain. Okay. Then you take a nice, slow, deep breath in for 3 and out for 3. And that oxygen from that breath turns off the adrenaline of that negative thought. And that's one of the first ways that we can control that anxiety and catastrophizing. Okay. So stop sign, deep breath in, out. And then you've got to remind yourself it's a thought. It's not real. So what I say to myself is, oh my God, Jill, you are not God. You cannot predict the future. If somebody says, hey, you want to go to Tahoe next weekend? My immediate reaction is usually, no, I'm not going to be able to find a bathroom. I have to stop myself. Stop sign. Deep breath. Oh my God, I could have a fantastic time. Yeah, I'm going to try. Right? If you struggle with anxiety, I have a really good video on our website about it, in our Living with IC video series, also on YouTube here if you go to our videos. I really, really want you to watch it, and I really, really, really want you to perfect the stop sign. I got that in a class called Phobies, taught by a surgeon with anxiety disorder, and he was fantastic. So when you get control of the adrenaline, you control the anxiety. When you control the anxiety, everything calms down. But if every other thought is a scary thought, you are twirling with adrenaline, which is just driving the fear and driving everything else. So the secret here is to control adrenaline. Stop sign, deep breath, minimize the thought. Oh my God, Jill, you're not God. It could be a beautiful day tomorrow. Okay. All right. So that's kind of it for some of the. I mean, there was a lot of research studies happening, but you don't really need to hear the. Let's see. I think a proteomic analysis of IC bladder samples, yada yada yada. Okay, you don't need to. I don't need to go over that for these. So anyway, it's very, very exciting now. The most exciting time of the year is the American Urology Association conference. Stacy Shannon represented the IC network there. She's on her way home right now. I will have a full report of the conference in our magazine, the IC Optimist, in our next magazine, and along with comments from the various doctors on what they think about what's happened. So I will keep you posted. Now, I will say that the class this year was taught by Dr. Phil Hanno and Dr. Quentin Clemens, and then a doctor from Europe, and Dr. Sandor Lavaz. What disappoints me about the way that they teach this to other doctors is that they're not talking about subtyping first. That's what we do. And that's what a lot of the top doctors do now, is we need to understand your unique variation of IC before we can talk about the right treatment for your unique variation of IC. And they just kind of dove into medications and stuff like that. Then they kind of got to subtyping later. But anyway, other than that, I got all the research studies for everything. I will tell you that they did actually, for the first time, talk about pigmentary maculopathy with Elmeron. I hadn't seen them. Well, they didn't talk about that last year because we didn't even know what was happening last year. And then the other really interesting thing is a new device from Europe that will allow you to do your own bladder installation without a catheter. That's pain-free. It's like I don't know. It's like this long, and it's like a little syringe that is attached to a syringe with your treatment in it. And they've got pictures of patients doing it. You basically put it at your urethra, squeeze it. Medication goes right into your bladder, pain-free, no catheter required. So that's what the doctor from Europe brought over. So they talked a lot about that. And we'll try to get more information on that, see if I can get a sample of that to show you. All righty. Anything else interesting here? I mean, I literally just got this last night at midnight, so. Talk about phenotypes. They're also proposing an inflammatory phenotype, an inflammatory subtype. That's interesting. They've got the central sensitization phenotype, which we know. They propose a neuroimaging phenotype. You know, when you're in pain, the pain goes, say, from your bladder to your spinal cord, from your spinal cord to your low brain, to your midbrain, to your upper brain. And you would think that it would be a straight line, like there'd be a nerve here that goes all the way to here, which gives you your pain. And it turns out that's not the way it happens. The way it happens in your brain is it looks like a thunderstorm. I mean, it looks like lightning. So different parts of your brain light up when you're in pain. And the more intense pain, the more prolonged pain, more and more parts of your brain light up. And so they're proposing a phenotype based upon how many areas in your brain light up, which is very, very interesting. And of course, know too, that when you occupy your brain with other things, you restrict that. And we've talked about that from the book When It Hurts Down There. Okay. All right. Well, listen, those are just kind of spontaneous notes about this stuff, spontaneous comments that I have going through this the first time. I will be going through it much more in depth, and we'll be doing an article on it in our magazine. MAP Research Network sites, for those of you in the United States, let me just tell you where they are, because there are usually research studies available. You've got a MAP Research Network site for IC studies in Seattle, the University of Washington, Cedars-Sinai in LA, USC in LA, University of Colorado, University of Iowa, Washington University in St. Louis, Northwestern University in Chicago, the University of Michigan in Ann Arbor, Queen's University in Kingston, Ontario, Canada, Harvard University Children's Hospital in Boston, and at the University of Pennsylvania. Pennsylvania is doing the data. Colorado is doing the tissue analysis. Right. Okay. 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 Let's just take a breath for a moment. And I think it's time to take some questions, don't you think? Drinking my rooibos tea. I wish you could see it. See that? Rooibos tea. Pumpkin spice rooibos tea from Harney & Sons does not irritate the bladder at all. For anybody who's looking for something other than water or chamomile or peppermint tea. So let us go through these questions. Let's see what you've got here. And again, our Facebook stream failed. Facebook is having some sort of error today. So we tried 5 times. It wasn't going to work. So getting back to Isabella's question, which was the first question, can you please share patient responses to cyclosporin B? How can one get it prescribed, and by which type of doctor? Okay, so cyclosporin B is a step 5 treatment option. And so the assumption here is you've done everything from step 1 through step 4. Generally, cyclosporin B, we're going to be looking at people with very, very, very intense symptoms. Finding a doctor to prescribe it is challenging. It's not usually a urologist. Usually it's what's the name of that specialty? Your urologist would refer you to another doctor, a rheumatoid specialist. If Karen comes in, she can tell us because she's taking it. Are there any tests to see if one can be a candidate? I don't know. You can check off the top of my head. I don't know. I mean, generally, when you take something like cyclosporin, it suppresses your immune system. It makes you a bit more immune compromised. So I'm sure you cannot do it if you've got any long-standing chronic infections of any type or any other medical conditions that could be exacerbated by cyclosporin therapy. So as long as you meet those baseline criteria, you might be able to do it. It is something that when you first read it, it's kind of scary, but cyclosporin, things like that are often used for tissue rejection. If you ever have to have an organ transplant, they're going to put you on big time steroids, stuff like that. For IC, the dosage is very, very small, although they will titrate you up a little bit. And I will say the patients that I've worked with who have used cyclosporin, it's been a blessing. In fact, I was just talking with one last week, and she hasn't had to do a bladder treatment in 1.5 years because of the cyclosporin. The challenge is when she gets the flu or cold, it's a little bit more intense and it lasts a little bit longer. I know of another case of a man with a very, very severe Hunner's lesion, and they were going to use the cyclosporin for him too. So you don't see it used frequently, but it's certainly a viable option, and it's got good research studies behind it, and you can see those on our website. I hope that answered your question, hon. Julianne says, I get very bad bladder spasms with my time of the month. Is there something I can do about it? Yeah, you can use an antispasmodic. Use ditropan, also known as oxybutynin. Ditropan is very, very good at turning off bladder spasms. It will usually turn them off in about 20 minutes once you take the medicine, little blue pill. There are some other medications like ditropan that might be helpful too. That flare when you ovulate, or the flare when you right before your period, that's just because of estrogen changes, right? And so there's one thing you really need to know with that, and that is not a flare to get worried about. It is a short-term flare. The flares that I had when I ovulated, back when I actually had ovaries, lasted about 8 hours. They were intense, but they were very, very short-term. The flares that I had before my period were, like 48 hours before my period, maybe for 3 days, 2.5 days, where my bladder was more vulnerable. But those are the ones where you just can't panic about them. It's just, you're ovulating. It's just your period. And as your body improves, those flares are going to improve too. And that was really when I was doing my voiding diary, as I talked about when we did our stream on last Monday. When I did my voiding diary that summer, I could see that, I learned 3 things about it. I learned, number one, that I flared when I ovulated and I didn't need to worry about it. It's like, okay, I'm ovulating. I'll be fine in 6 hours, 8 hours. No sweat. No reason to get upset about it. No reason to catastrophize over it. Hello, it's just you're ovulating. The second thing I learned is as I got better, it went away. That the hormone-induced flares improved dramatically. And the third thing I learned from doing a voiding diary is it allowed me to see that I was improving even if I didn't think I was improving. So I can remember when I did urgent PC, which is the ankle nerve stim, at week 3 or week 4, I had my first 2 hours without pain. And in week 7, I had my first day without pain after a year's worth of pain. And so if I had not done my voiding diary, I might have stopped it, because what my voiding diary was showing me was that before I started it, I was peeing 40 or 30 times a day. And then once I started it, it was getting better. I was going 25 times a day, and then 22 times a day, and then 20 times a day, and then 18 times a day. Even though my pain was still a level 8, I could see something good was happening. I could see that my frequencies was improving. There was no doubt in my mind the good things were happening, even though I was in pain. So when you have a voiding diary in your hands, you cannot deny your own evidence, your own information. And the challenge is, when you have a bad day, you forget that yesterday was a good day. When you have a bad day, you catastrophize. You think, oh my God, it's so bad. And then you go back and you look at your voiding diary and go, wait a second, I had 4 good days last week. It's really not as bad as I thought it was, right? That's what pain does. Pain makes you, it gives you anxiety. And so when you've got this nice diary that you can refer to, that you created, and you're not lying to yourself, it is right here: Tuesday, Thursday, Friday, good days. Yeah, okay, it's a bad day, but I can't say that I'm getting worse. It's right here. I'm having good days. And you'll see that the good days will increase as you find the treatments that work for you, as we identify your correct subtype, et cetera, et cetera. And for those of you who came in the Facebook feed, Facebook's just having a problem today. So they got a support group meeting from me on Monday. So, and I'll do another one probably tomorrow. No, I can't do it tomorrow. I got to go to the physical therapist. Oh, well. Does Dr. Robert Evans at Wake Forest treat vulvodynia too? Is vulvodynia a part of IC? DP? Yeah, vulvodynia is definitely a part of IC. For those of us with central sensitization, we call it IC on the outside. What it means is that the nerves in the surface of the skin of the vulva become hypersensitized. In some cases, there can be candida infections. In other cases, there can be estrogen atrophy. And in some cases, it's about nerves that are just inflamed. And so vulvodynia comes hand in hand with IC in many IC patients, myself included. I actually had vulvodynia in high school before I even had IC. I had vulvodynia, I'm going to say, for 4 or 5 years before things calmed down. Wearing jeans with vulvodynia, very hard. Thank you, Ryan. Donna says, are they using opiate use in IC patients as an excuse for the opioid crisis? We should not be the fall guys for that. Yeah, they're not going that far, but they are. I've seen multiple research studies right now showing opiate use in different medical conditions, ultimately leading to the suggestion that maybe patients are being prescribed too many, and that's just bullshit. Dark mode, guys. Dark mode. I'm going to swear. You know, my sister had her gallbladder removed. She only had opiates for 5 days, and she has suffered. They gave her Tylenol, and she had complications too, and they still wouldn't give them to her. In contrast, when I had my hysterectomy 2 years ago, I'm going to tell you right now, I said to the doctor, I said, listen, I'm not doing anything. I don't care about the cancer. I don't want my bladder to, I don't want to go back 25 years. I've been close to pain-free for a decade. And I told him, hands out, I will do nothing without pain medicine, period. And not only will I not do it, I will have a prescription in my hand 2 days before. I will have the prescription filled and in my bedroom so that it's there when I get home. I will have a promise from you that you will be there for me if I suffer a complication and need more treatment. And he absolutely agreed. That's the way I approached it. Because I got, that might be crazy. I don't know. Is that crazy? Might have been crazy for me to say I didn't care about the cancer, but I didn't want to go back into IC pain. And I was not going to allow myself to be in intense pain that was untreated. And that's what I said to him. That's exactly what I said to him. I've worked hard. I mean, I've worked hard to get here, and you're not going to screw it up for me. So, um, and if he didn't trust me with the pain meds, then I was going to go look for another doctor. But he did, and things went well. Brian says, thankfully, I have a primary care doctor who's not afraid to write me medicine for pain because he knows that I don't overuse them and I only use them when I'm in terrible pain. I mean, I think that's basically what I've said to doctors is I've said, okay, I've had IC for 25 years. How many prescriptions have I had? Am I an addict? You tell me, am I an addict? I personally take a quarter of a pill once every couple months. Does that make me an addict? No, it makes me smart. I'm calming my nervous system. Also, I just want to say that I had a patient call me who was very upset because she said that whenever I said I used a quarter of a pill, that made her feel bad because she needed to use more than a quarter of a pill. And I don't want anybody to feel bad. We all have different biologies. We all have different drug tolerances. Finding the right tolerance for you is going to be different than what is for me. And if you have to use a little bit more than quarter of a pill, that's okay. There's nothing wrong with that. We just, one of the mistakes that patients make, though, I'm just going to say, is if you wake up in the morning and you have had really, really bad pain that night, and you go, "Oh, it's really bad. I better take 2 pills." And I always believe that that's a mistake. Um, you have a certain number of nerves in your spinal cord that go to a certain number of nerves in your brain. If a half a pill will turn all those nerves off, is there any reason to take a pill or 2 pills? The answer is no, not usually. But again, it's about finding out how much medication will turn those nerves off for you. For me, a quarter of a pill will turn those nerves off. But for you, it might be a pill. But the point that I'm trying to make is don't double it just because you think the pain is worse. You still have the same number of nerves. Start with a small amount first, wait an hour, see how you do, and talk with your doctor about how you should be using your pain meds. That's what I did. It helps. I have a degree in pharmacology. I also chaired our state pain conference, so I've had an opportunity to testify in Sacramento about pain use and about pain medication use. And generally, what all the experts say is you catch pain early. Pain is like a fire. If you got a fire in a cup, 1 glass of water will turn it off. If you put this fire next to your drapes and your whole wall catches on fire, and then your house catches on fire, it's going to take a hell of a lot of water to turn that fire off. And so pain is the same way. If you can catch your pain early when it's small with a tiny amount of medicine, then you have potentially nipped this flare in the bud. If you wait until you're bawling your eyes out to use pain medicine, you basically allowed your house to catch on fire. And that's generally a mistake. If I'm in pain for a half an hour, and I don't mean a little pain, I mean, that intense searing bladder pain, stop what I'm doing, grab a heating pad, get myself on the recliner, and I just sit with them heat and see if I can get muscles to relax. If 30 minutes later I'm still in pain, I give myself permission to take a little tiny bit of medicine. And I wait an hour. I don't do anything for an hour. I don't take any more meds for an hour. I want to see how I'm doing at the end of that hour. If at the end of that hour I'm better, then I'm done. Don't need to do anything. If at the end of that hour the pain is still intense, I give myself permission to take another quarter. And I wait an hour. And 9 times out of 10, that stops the pain for me. Every now and then it doesn't, and then I have to take a little bit more. But the thing is 4 hours later, you've only used a pill anyway. Whereas if you started with 2 pills, you've used two very difficult to obtain pills. Does that make? I hope that makes sense. Is it common for pelvic floor patients to end up with spondylitis and spinal stenosis? Pelvic floor muscles so tight that they are not supporting the spine any longer. Very painful. Yeah. I don't know. That'd be a really good question for a physical therapist. What I do know is that what happens with injury is your body starts adapting to injuries in dysfunctional ways. So, as an example, I have an injury to my left piriformis muscle that I've torn 2 or 3 times. And as a consequence, I've got scar tissue there. So, what happens is my right side does most of the work because my left side is not that functional. And what they found was that had been going on for so long, my left glute muscles literally just didn't turn on. My right side was doing almost all the work. And so with physical therapy, we're retraining those those muscles to activate again. So it wouldn't surprise me if something like that happens. And we getting back to kind of long-term muscle dysfunction and trying to repair those is important. Again, I was working with a patient last week, and she remembered. No, it's a guy. No, it's a guy. He remembered a really bad childhood back accident where he jammed his testicles on the bar of his bicycle. I have very distinct memory of doing that really, really badly. And in their diagnostic workup with him, the frequency urgency pain, his pelvic floor assessment was absolutely terrible. And he was trying to figure out why it was so bad. And we just started going back, and it's like, okay, do you remember anything happening when you were a kid? And he's like, no. It's like, no, a bike? Were you riding? Come on. Every guy rides a bike. Did you ever have a problem with your bike? He goes, oh my God, yes, I did. And he told me about the accident. And that was the foundation for his original pelvic floor injury that has led to 3 decades worth of dysfunction. And now they've got to fix that. And that's going to be hard. That's not, you guys, 6 physical therapy visits is not enough. You're going to be doing, if you're one of those patients like I am, you're going to be doing a good muscle work really for years, because you don't want to go back. I mean, you got to do your stretches and work on that. Understand that your anatomy changes over time. Elise, I'm trying to follow your discussion here. Oh, here, hold on. It fed forward. Courtney says, I just had surgery for my interstitial removal. My doctor didn't prescribe my medicine. She had her resident write it, and he only wrote it for 3 days. Yeah, that's why, man, I get it in hand. I say, listen, I won't fill it until right before the surgery, but you're going to give me this paper prescription. I'm not going to walk out of the hospital after procedure with your prescription. I want it in my hand beforehand. I want it filled beforehand. I'm sorry, hun. I'd like to hear how your interstim removal went, though. Were they able to get it? Were they able to get the leads? Were they able? Tell us how that went. Eileen asks, what about medicinal marijuana, hun? I'm all for it. If you got medical marijuana in your town and it works for you, go for it. Go for it. You know, we weren't allowed 20 years ago with the IC network. I mean, we already had patients who were using medical marijuana safely, but it really wasn't legal anywhere. And so I had, my attorneys told me I had to delete all those discussions, which was difficult because I knew that we had success stories. And so if you were talking with me on the phone, we talked about it, I would share some of those success stories. We weren't really allowed to talk about it publicly. Really would have discredited the IC network, and which is why you didn't see us talk about it or the ICA talk about it at all. But 20 years has passed. We have a lot of research now supporting the use of medical marijuana. That's why it was approved in California. I went through all of those research studies. I am absolutely convinced that medical marijuana can be beneficial for some, but not all patients. The thing here, though, is you've just got to make sure that it is organic and not contaminated with pesticides. Remember that marijuana has two key active ingredients, THC and CBD. THC, tetrahydrocannabinol, is the ingredient that makes you high. CBD, a cannabinoid, cannabinol, okay, you know what I mean. That's the one that fights pain. So when you're doing medical marijuana, there are many, many varieties of marijuana, as you know. I mean, some have crazy names, some of them don't. You're looking for a low THC, high CBD, no THC, high CBD. That's what you want. And as long as you can see test results on the manufacturer's website showing that it's not contaminated with pesticides, you're gold. Give it a shot. In our survey, we have one of the longest running surveys of medical marijuana and IC. I think I've been running it for well over a decade now to gather data from patients. It's still, I'm pretty sure it's still alive. Let me look. Let me look at the latest results here. And I think we're going to have some new CBD products in the ICN shop. Let's see. Yeah, here it is, medical marijuana and IC. We've got about 700 patients who have completed it, because not everybody wants to admit that they have used medical marijuana. So it's taken us time to get this data. And let's see, just out of curiosity, in this group, 76% of respondents have used it in the last 6 months for pain. 64% said medical marijuana reduced their symptoms by 50%. 13% said it reduced their symptoms by 25%. 17% said it made their symptoms go away completely. 4% said it did not help. And 2% said it made their IC symptoms worse. And it improved frequency, it improved urgency, it improved pain. I actually published this new data. It reduced pelvic floor dysfunction. It improved nighttime sleep quality dramatically. Improves mood, fibromyalgia, nausea, migraines, endo. Allows me to sleep through the night, but when I woke up with a very full bladder, it was excruciatingly painful. I would say it dulled all the symptoms a good bit, but helped most with urgency and muscle spasms. Okay, so anyway, yeah, man. If you're being denied pain care and we've got something else that might help, I don't want you to suffer. And if marijuana is available, why not give it a shot? Becky says, you mentioned acupuncture. Dr. Carolyn Eccles, a urogynecologist in Philly, does acupuncture. Good to know. Lisa says, my last microgen test showed Enterococcus 96%. Worth a course of antibiotics? I also have colitis and have been struggling with diarrhea lately, so the thought of antibiotics freaks me out. Lisa, you know what? Hold on a sec. Let me just go back to that study that was presented at AUA. Hold on. What did I do with it? Here it is. Let's see if they found Enterococcus. Okay, here we go. A midstream voided specimen was collected from 21 IC patients and 20 asymptomatic controls. The two groups had similar demographics. There were no significant differences in both groups. There were some differences in community structure. Group P strep, staph, Staphylococcus lugdunensis, and Corynebacterium were more prevalent among asymptomatic controls, while Streptococcus mitis oralis was more common with IC. E. coli was found more often in IC than controls. Okay, so they did not, and I'm going to say that this study was sponsored by the Interstitial Cystitis Association. Really, really good to see them funding truly meaningful research. Compliments and kudos to them for funding this study. So they didn't mention Enterococcus. You know, this ultimately in I think it's in the course that I read last night. The challenge with next-gen sequencing is that everybody's biome is different to a certain degree based upon where you live, what you've eaten, what you've been exposed to, all that sort of stuff. And we don't really know what's supposed to be there for you, Lisa. Is Enterococcus supposed to be there? I don't know. I don't know. Lisa, I'll tell you this. If you wanna email me, we can dive into the research a little bit more, or you could even tweet to Dr. James Malone in Australia, who is the champion of chronic UTI in patients with IC, and see what he says about Enterococcus to that degree. That would be good. He's a pretty controversial figure, but he is kind of the one of the champions believing that many patients with quote IC or lower urinary tract issues have chronic infection. It would be very interesting to get his opinion on Enterococcus. Lisa, as your body heals, does frequency and urgency decrease? Absolutely. Yes, it does. Hi, Barbara. Hey, you guys, I totally forgot to thank our sponsor. Our sponsor is Preleaf. The only supplement that it reliably reduces acid. If you got to go somewhere and eat pasta, eat pizza, drink some alcohol, something like that, that you know the acid would irritate your bladder, please try some Preleaf. It's been around for 30 plus years. Very reliable, very safe overall. Of course, if you're prone to calcium-based kidney stones, you should not be using anything with calcium like this, alrighty? But please don't take it like candy. You know, you only take it before you eat. Very, very happy to have Preleaf. As I've shared before, we almost lost Preleaf a couple years ago. The original manufacturer was really considering shutting it down. And when he told me that, I was just stunned. And I went, oh my God, why? And he said, well, it was a manufacturing issue combined with poor sales. And I said, well, you do know marketing, dude. Can we do some marketing for you? And I helped him create a marketing campaign known as the IC Diet Project. Simply delicious, low acid eating made simple, where we focused on food. If you go to icdietproject.com, you'll see it. And we continue to add good recipes for that. I blog for these people now. So I just put on their Facebook page a new blog about low acid salsa. Pico de Gallo. Elise says, I feel so helpless now that the pain clinic has decided to take opiates away from me, even though I suffer a lot from all the pain I have on a daily basis. They want me to go on Neurontin. Well, hon, I mean, Neurontin is viable. Neurontin calms nerves down. If you're IC subtype 5 central sensitization, Neurontin makes total sense. So I mean, it's a viable option, absolutely worth exploring. But Elise, again, to me, it's all about understanding what's driving your pain. Do you have a Hunner's lesion that needs to be treated? If it does, let's get it treated. Do you have estrogen atrophy that has made your bladder wall more vulnerable? If so, let's use some estrogen to toughen up that bladder wall. Do you have tight pelvic floor muscles? If so, let's do some pelvic floor physical therapy. If we can reduce the source of that pain, you won't need the medication as much. Elise, you should also Google FDA warning opiate crisis so that you understand what the FDA is now saying about how you should go off of it. It should not be cold turkey. It is a very, very gradual process. Hello, Nat King Curry. And she's doing 3 years of pelvic floor physical therapy. You know, I knew about the pelvic floor work 20 years ago, and I didn't start it then. And boy, was that a mistake. I've said it before, I'm a little passive aggressive when it comes to my muscles. What do I do to calm down the pain and severe burning for the vulvodynia to take? Okay, so DP, number one, you need a perineal wash bottle. Every time you pee, you got to rinse yourself off with water because the chemicals in your urine are irritating the nerves on your vulva. You're probably having vulva, what I call urine burn, where your urine feels very hot as it's crossing your vulva, and you need one of these. Let me just take it out of the plastic here. All subscribers to the IC Network get a Peri bottle as a gift, one of our gifts. We have a number of gifts we give patients. Fill it up with water, leave it next to your toilet, rinse yourself off before you pat dry. Do not just, water will remove the chemicals from your skin, toilet tissue will not. So the first thing we've got to do is we've got to rinse the chemicals off of your skin, DP. The second thing you've got to do is you've got to look at products that are triggering a chemical reaction. Your vulva, if it's dry, it's wide open to chemical exposure. This means you got to be careful with mini pads. If you're wearing a mini pad every day, don't. Number two, laundry detergent. You should only be using All or Arm & Hammer for sensitive skin or Dreft. I was not a fan of All. It was never recommended before, but apparently the new formula is much better, and my dermatologist was recommending it. And I switched back to it. And so far, so good with that. You cannot use any fabric softener. You should not be using any dryer sheets. Your bath soap should only be Dove unscented or Basis for sensitive skin. You cannot use any gels, any, body washes. Those all contain extra chemicals, which are known for that. If you can, take a pair of underwear, cut through the middle, vertically, okay, so if you hold your underwear up, you've got the center liner, right? So your center liner is like this. Take an old pair and cut it like this, and so that you can get some air in there that you can wear around the house when you're wearing a dress, or at night if you like to sleep with the underwear on. That's a good way of just kind of getting that out. Make sure your sheets are washed also in these mild detergents, no fabric softeners, nothing like that, no douches, nothing harsh. Remember too that your pelvic floor muscles, if they're very, very tight, are going to restrict blood flow to your vulva as well as to your bladder. So you've got to try to relax those muscles. You can use some heat on your belly, but many vulvodynia patients actually prefer using a little bit of ice down there. So you could try an ice pack for 10 minutes at a time, wrap it in a cotton cloth so you don't have direct ice touching your tender tissues down there. And we really, really, really need to look at the quality and health of your skin overall. And is this related in any way to estrogen atrophy? If it is, then we're getting some estrogen in there through a topical preservative-free estrogen cream would be one of the best ways to allow your body to produce more mucus that protects the nerves in your vulva. Okay? Got a good section on our website on vulvodynia. Come on over and look at that. ic-network.com. We finally got the domain name icnetwork.org. Took me 20 years to get it. So we're going to be transitioning our website over to icnetwork.org soon. You can't go there now, though. It's not pointing anywhere. But it will be this week. Barbara says she doesn't know what to do with pain anymore. You have the Interstim. It worked at first, and now it doesn't seem to work for me. Barbara, what does your doctor say about that? The doctor put the Interstim in. Can you change the programming of the Interstim? Does it need some revision? Nat King Curry has responded beautifully to Hunter's lesions and was bedbound for a while. It was pretty severe using medication. Now he or she's off all of them and can walk for hours with still have some pain, but you've been lucky. But he declined medical marijuana. I wouldn't decline it. I mean, I think it's reasonable. Thank you, Barbara. Barbara asks, how am I? I'm scattered today. I'm scattered because our beloved neighborhood cat showed up bleeding at my house this morning in terrible shape. And I had to call the owner and go, what happened? And had the owner come and get him. I'm upset about that. It was a terrible reaction to a flea medicine, Cheristin, which I'd been giving my cat for a year before she died. And I'm absolutely convinced that it killed my cat. And be very, very careful with the flea medicine, Cheristin. If you haven't figured it out, I'm a pretty strong empath, and I'm a real animal empath. And if an animal is in pain and distress, I am in pain and distress. So I'm a little in pain and distress for this poor kitty right now. I love him. I've known him for a long time, 15 years. Courtney says, my Interstim worked amazing until the wire fractured. Then you had terrible pain. Once it was removed, I did not have the pain, other than the actual pain from the surgery, of course. Yeah, that's, of course, the problem with Interstim is it has a lot of adverse events and can break. Barbara says she's thinking about having her Interstim removed. Yeah, Barbara, if you're thinking about it, do it sooner rather than later, because the longer it's in, the harder it is to take out. You know, what happens with those leads is you get scar tissue over them. So doctors kind of have to chip away at the scar tissue to pull them out. And there are some situations where they literally cannot get it out, and they just cut them off and they leave the lead in your back. And that's bad. We don't want to leave metal in your body. So if it's not working, get it out. Nat King Curry says, I think if a celebrity was flattened by IC, then I'd receive more attention as well. We actually have had quite a few celebrities with IC. Pamela Sue Martin, a girl from The Young and the Restless, a actor from ER. I think the most recent star I worked with was one of the leads of Phantom of the Opera on Broadway. That was like 10 years ago. A male lead, as a matter of fact. We had at one point in time a congressman with IC, but I don't know. I don't think he's in Congress anymore. I actually wrote a short story about Mr. Spock getting IC on the Starship Enterprise and what the doctor did for him. It's pretty funny because Mr. Spock just stood there and took it while he was while he was standing by Captain Kirk. Didn't ask to use the restroom, and finally Kirk reached over, and noticed him squirming, and said, "Spock, what's wrong?" And I don't remember how I finished it, but it was pretty funny. Kirk got him to go pee. The things you think about. Okay, so Eileen, you're from Michigan. You ordered it. Yes, you ordered your CBD yesterday. You're having pain about a minute after urinating that lasts about 15 minutes. So again, that would point to your pelvic floor and or a bladder spasm. So when you have pain at the tail end of urination, as those last couple of drops are coming out, that is your bladder kind of compressing and the walls touching each other, and they start quivering. And that's the equivalent of a bladder spasm. And in my experience, that happens most frequently if you have infection or if your bladder wall is fried. Because I mean, I look at that bladder spasm as the last ditch attempt and a way for your bladder to tell you it needs your help desperately, because when your bladder's injured, you start with frequency urgency, and then it gets more and more intense. You're running to the bathroom, then it starts to hurt, and you're doing this, and you don't go to the doctor, and it's getting worse and worse and worse, and then finally you feel a fluttering sensation sometimes. And that, like, literally is that bladder just going, please help me. It's trying to get your attention, for lack of a better term. Ditropan can turn off bladder spasms in 20 minutes. So it would be very interesting to try ditropan at least once or twice to see if that makes that pain go away. If it doesn't, then it's a pelvic floor pain. And so the question then is, would a muscle relaxant help that pain go away, or a vaginal Valium suppository? So again, pain after urination is normally muscular. So the question is it the smooth muscle of the bladder, or is it the striated muscle of the pelvic floor? Elise lives in Norway. Patients with IC are denied medical marijuana. It's just approved for patients with cerebral palsy and for terminal illnesses. Wow. What about hemp? Can you get hemp oil, hemp CBD? If you can't get medical marijuana, can you get hemp? I'm just going through your questions here. You guys are so good at supporting each other. Becky says she's doing great with the estrogen cream. Makes a world of difference. Me too. Estrogen cream really, really helps me. Eileen says she was diagnosed with vulvodynia 30 years ago, like me. The thing that helped her is petroleum jelly Vaseline right on the site within a day, 100% better. Because it's a coating. It protects that tissue. Putting something like, as long as you can handle the stickiness of Vaseline, putting Vaseline on your vulva before you pee puts a barrier there so urine won't irritate it. That makes total sense. I just didn't really like it. I didn't like the sensation of Vaseline down there, although I'm tempted to do it again because I'm still dealing with this ridiculous candida infection. It's way better, but it's just still prickles me every now and then. Yes, Lisa asked, once the .org domain points, will the .com still work? Yeah, everything will still point to the website. I have been waiting for 20 years. I had to pay $1,000 for it to get icnetwork.org. The guy originally had it, who had icnetwork.com and icnetwork.org. And I forget what he was doing with it. This was in 1994. He promised it to me because his website didn't work. and he said he'd give it to me, and then he lost my contact information, and so he put it up for sale, didn't tell me, and a guy from uh, Malaysia bought it. And icnetwork.com still sitting there, but at least we finally got icnetwork.org. So yeah, the cat. I love that kitty cat. I told him he had to come get him. He said he's on prednisone now. He's doing better, but he was still a wreck. And I just said, listen, I got work to do. I got to do a stream. You've got to come get him. I can't have him here. My mom is going to freak out and keep running into the room every time he scratches. You know, I knew within a day of that cat getting Cheristin that there was a problem. The cat showed up at my house and he wasn't acting normal. And I called him and I went, something's wrong with your cat. And a couple more days ago, finally came up and I contacted him again. I mean, something's really wrong with your cat. Did you do something? And he goes, yeah, we did a flea treatment. I went, did you do Cheristin? He goes, yeah. I said, that's it. This poor cat now is almost bald from the Cheristin and scratching so hard. He's having a dermatologic reaction. And he stopped eating too. He's on prednisone now. I hope he makes it. I love animals. I can't have I don't want another pet in my house right now. I was torn up by losing Sammy, and I'm caring for a 90-year-old, and I have to deal with, their emergencies. I can't deal with an animal emergency too. That has exceeded my threshold of what I can tolerate. All right, guys, any last questions? It has been an hour and about 40 minutes with several false starts along the way. You know what? Oh, I know what it was. I know. Wait. So, guys, I posted a picture on my Facebook page earlier this week about these red bumps that I'm getting. Right. So look, red bump. I even have, there's stitches right there because they're biopsying another one. So like I got all these red bumps. We thought they were angiomas, because when you push on them, they go away, and when you release it, it fills up with blood again for the most part. See, that's a really good. And my dermatologist calls she calls it a rash. I don't think it's a rash. I had them before. They started about 10 years ago, but I would only get, one or two. Now I'm getting, I have like 100 of them. I've got a lot on my legs. So anyway, I post this picture on Facebook, and right now there's like 20 other ICers going, oh my God, I have the same thing. I've wondered what those are. And so I think I'm going to do a survey about it, because I want to, we're doing another level of biopsies. My first biopsy came back as Fowler's disease. Now, Fowler's disease is common in men on the chest area. I only have a couple on my chest. I've got like 50 on my lower legs. Fowler's disease is not common on the lower legs. And so she's going to do a next round of biopsies to try to figure it out. So Fowler's disease is kind of an immune-related rash. But again, I don't think rashes do that. See, you can see that if you push it, it goes away. And when you release the blood, it just fills up with blood again. Does anybody else get these? I mean, I'm going to say that mine started with perimenopause, probably in my late 40s. So I'm curious. Anybody else get these spots? Elise says your daughter has a spot. Elise, do you have the spots? Yeah, Angie, they totally come and go. They last for about 2 weeks, 3 weeks, and then they disappear and then they come back again. I had one on my face this morning. I had one here for about 10 days. Darier's disease. What is Darier's disease? It's a skin condition characterized by wart-like blemishes on the body. They're yellow in color and hard to touch. Greasy? No. No, not at all. Nope. Somebody said porphyria, that it's a variant of porphyria, which is a vitamin B12 processing disorder. And for those of you who know, Barbara Flanagan, the original founder of the ICA, has long believed that IC has a porphyria connection in some of us, and it relates to heme processing and B12 processing. But I was looking at this. I was looking at porphyria rashes, and it's not a porphyria rash. No, it's not. Not even close. I mean, I'm looking. No, it's not. And it's not bumpy. It's flat. It's not painful. It's only pain. Chronic idiopathic. Okay, chronic idiopathic urticaria. Hold on. And I was talking to her. I was like, is it a vitamin deficiency? Could it be a vitamin deficiency? Could it be a weird sensitivity? Because I don't eat leafy greens because I've got gastroparesis. That says chronic idiopathic urticaria is hives, but it's not hives. There's no itching. There's no itching involved. There's occasionally a little needle-like sensation. It's like being stabbed with a needle for a fraction of a second. Whereas Karen here says you're having B12 issues and blood issues. So Karen, I posted on Facebook like 2 or 3 years ago, Barbara Flanagan's interview about her theory about B12 and heme protection. It's very interesting. So I'm going to do a survey. I don't think in all the research surveys done on IC, anybody's asked about dermatology. And I think it would be really fascinating to get 1,000 patients to share their skin condition. So Elise says, your mother has a serious form of anemia where she doesn't have intrinsic factor and there needs to have B12 injections. So I would wonder, Elise, if your mother has porphyria, a variant of porphyria. Prophyria, porphyria. And Karen, you have too much B12 and a low white blood cell. I don't know. Their porphyria has a genetic link with higher in people with a Dutch extraction. It's possible. Absolutely possible. Being one of these central sensitization kind of multiple pain patients is life is always an adventure because you just like never know what the hell is going to happen next. And this is not psoriasis. I'm doing UV light therapy. I go stand in a light box for 45 seconds at the doctor, and that's helped a lot. See, you can't see any on my arm right now, but I got stitches right there. I should take this off. Anyway, see, there's a stitch. Thank you. You like these earrings? Little butterflies. I got them at our local nursery for, I kid you not, like $7. I'm gonna go. I have to go back there today, get some more stuff for my garden. If you want, I can look and see if they have them, and I can buy some for you if you want. You can just buy them from me. Linda, you want me to do that if I find any more? Or I can at least try to find who makes them. You guys have any other hot issues going on in your lives? Do all synthetics sweeteners bother IC? Hi, hello, Maddie. Pretty much, yep. You know, I mean, guys, you got to realize our human body was designed for life 5,000 years ago. What was the sweetener 5,000 years ago for most of us? Honey. Honey. Synthetic sweeteners are so damaging to the brain. You know, they here, hold on, I'm trying to fix this light. What happens with a synthetic sweetener is that it fools your brain. Normally, when you eat something sweet, the sweetness on your tongue triggers your brain. It tells your brain energy is coming. And so when you eat something sweet, your brain goes, ooh, good, energy's coming. And then your body uses that energy in whatever you're doing, working out, walking, whatever. But when you do a synthetic sweetener, you put this massive sweet in your brain, but then your brain goes, hey, where's my energy? I got no energy here. And then what happens is it triggers you to eat more. It triggers you to eat more. And so diet soda has actually been linked to much higher rates of obesity than regular sugar-based soda. And so I'm not a fan at all of any synthetic sweeteners. And in the IC community, we don't, in our diet research studies, they are, as a rule, considered to be more irritating. Of the diet sweeteners, the Splenda was the one that was perhaps the least irritating of them. But even then, we had a note of caution about it because we don't know how Splenda is metabolized in the human body and what it could do to the bladder. So as an 18-year-old sufferer with IC, now listen, hon, I love working with patients who are teenagers. And I love it because I want to say to you what I wish somebody had said to me. And that is, this is not your fault. You have done absolutely nothing wrong. There is no shame. There is no blame. I don't want you to carry any guilt about this. I don't want you to feel like you're damaged goods. I don't want you to feel like you're lesser because of this. I don't want you to think that you're being punished. You're hurt. You're no different than someone who got hit by a car. You're hurt. And there's something about having something that people cannot see that creates doubt. It creates doubt in people you love. You get up at night and you're peeing and they don't know you're getting up at night. And then in the morning, when you're exhausted because you haven't slept well and people say, how are you? You say, well, I had to pee all night, and they don't understand the ramifications of that. They don't know what that does to your sleep quality. They don't know. If you've never had bladder pain, you don't know what the heck it feels like. It's not fun. And if it's not pain, if it's just frequency urgency, it's exhausting. It's absolutely exhausting. So we can be really tough on ourselves. We can really internalize this in a pretty bad way of starting to think that we're unworthy and unlovable, especially And men and women, you'd be amazed at what goes through our head. And so if I were there with you right now, the first thing I would do is I would look you in the eye and I would say, you are a lovely woman. And I'm so, so sorry that you're going through this, but we're going to do this together and we're going to help. And I don't want you to carry any shame or any blame. In fact, what I'm going to do is give you so much knowledge, so much information, so much power that you are going to kick butt and not let anybody mess with you. But the reality is that when you've got this, you're going to be running to the bathroom more until we can figure things out and calm things down. So, Maddie, I don't know if you're familiar with the subtypes. Let me just kind of go through these subtypes, because I really want you to hear this from me. Okay, so we're long past the days of thinking that IC is an incurable bladder disease. Long past that day. Oh, cool. Okay, so you've been here then. You're not new. You've been here. So for those who don't know this, again, let me just say it. We no longer think of IC as an incurable bladder disease. We think of this more as an injury or a trauma. And we know that because a one treatment fits all approach does not work. Elmeron didn't work for everybody. Elmeron only worked for a very, very small population of patients. And in the class on IC taught this morning, they actually brought up the studies where it was no better than placebo. No better than placebo. But here's where we see the diversity. We see the diversity in the symptoms. Some patients have terrible pain, others have no pain. Both diagnosed with IC. Are they the same? No. Some patients have bladders that look like bloody hamburger. Some patients have normal bladders like me. Both diagnosed with IC. Are we the same? Hell no. Hell no. No wonder all these research studies failed early on. Talk about putting a cat and a dog and a horse and a pig in the same study. We need a study of just cats. We need a study of just dogs. We need a study of just Hunter's ulcers. We need a study of just pelvic floor, right? You really see the diversity in how patient symptoms begin, because for some people, IC begins after falling on their tailbone. For others, IC begins in childhood. For some, IC begins after menopause. For others, IC begins after chemotherapy. Again, the diversity is amazing. And so now what doctors are doing is they're trying to understand these subtypes, these variants. And in Europe, they've got 12 to 16 variants. In Canada, they're working with 6. In the United States, we don't have a formal nationally approved subtyping system, but I use a subtyping system that was created by Chris Payne, who ran Stanford University. And he proposed 5 variants: Hunter's lesions, bladder wall injury, pelvic floor injury, pudendal neuralgia, which is a nerve injury, and central sensitization. But hold on a sec. You know what? There was a slide. Let me see if I can find this slide and I'll print it out and show it to you from this class. It was interesting because it showed even more variants. Let's see if I can find it. Okay, no, it must be at the other end. There's like 200 slides in this presentation. Let's see. Oh, here it is. Okay, here, hold on. Command Shift 4. Let me do a screenshot. Map Research Network. Okay, now I have the screenshot. Let me go to my desktop. Here's the screenshot. Yeah. Welcome to life in the big city, also known as my office. All right, let me print this out. Oh yeah, good, cool. It's going to print out on a whole page too. This is probably the most interesting slide that I saw in the IC presentation. So here, hold on a sec. Okay. This is also from the MAP Research Network. See, this is why we need to be on Twitch TV so I can share my screen and we don't have to do this. So this inner circle talks about different things that we know can be happening. Central sensitization, psychological factors like PTSD, childhood trauma, environmental factors, genetic predisposition, a neuroendocrine disorder, pelvic floor dysfunction, mast cell activation, altered urothelial permeability, aka bladder wall, inflammation, infection, peripheral sensitization, stress. Okay, so there you go. Talk about variants. Those are all things that we know can happen in this pelvic pain community. But what's even better are the yellow boxes, which talk about treatment approaches. Because remember, this is about finding the right treatment for your specific presentation. So if you are, for example, have Hunner's lesions, then you're going to do Hunner's lesion therapy or lidocaine. If you've got infection or inflammation, although I don't understand why they would put this here. They say DMSO. That would be for inflammation, not infection. If you've got altered bladder wall permeability, heparin. If you've got mast cell activation and antihistamine like Vistaril. If you've got pelvic floor dysfunction, it would be myofascial massage. If we're dealing with childhood trauma, then we're going to be doing some cognitive behavioral therapy and mindfulness. All relevant, all important. If you've got central sensitization, then doing a neuroleptic. So for who it was who was being forced off the OxyContin and putting on Neurontin, here we go. Central sensitization, that would help central sensitization. If stress is an issue, because we know stress tremendously worsens pain, then we need to make sure you've got good stress management skills. And so this is a really, really, hello, we're not all the same in any way, shape, or form. And this completely shows why all those early IC trials failed. You can't mix all these into the same study. And even then, I've worked with several companies who want to do clinical trial recruitment and through the IC network. And the very first thing I say is, are you going to have them follow the diet? And they say no. And I say, then what's the point? What's the point? Why would you do it if you're not going to have them follow the diet? No treatment can counteract the effects of a cup of coffee a day. So if you're working with altered urothelial permeability and we have a bladder wall injury and you're allowing them to drink coffee, do you really think your treatment's going to work? No, it's not going to work. You'd be amazed how many studies stupidly allowed patients to drink coffee and soda. And we never got a real test of how that worked. Any recommendations for stress management skills? Hun, you got to remember, when you were born, God didn't give you the skills to deal with stress. You were a baby. You got to learn them. This is about learning new skills. And so finding a good stress management class is important. Learning to process anger is important. Learning to be human is important. We try so hard to pretend that we know it all. We try, especially when you're a kid and you're trying to prove yourself to everybody. It's greatly comforting to be able to walk into a stress management professional's office and say, I have no clue how to do this. Could you please help me understand what I'm supposed to do when my parents are dying, when my IC is flaring, when my cat is dying, when work is pounding at me, when I've got, this is why support groups are great, because you can learn from the skills of other people, right? it's when you try to do it alone and you've got all this pushing on you that you kind of go a little back. You start to doubt yourself tremendously. You start thinking that you're damaged goods. You start thinking that there's something wrong with you, and there's nothing wrong with you. You're just dealing with life. Life is hard. And having some implicit skills to get you through the day is important. Journaling. I think one of the very first things that really helped me was journaling. You know, I mean, my childhood was ruined to a certain degree by one neighbor who murdered another neighbor. And we had a predator in my neighborhood for years, attacking people. And he was a kid my age. And he raped and murdered people. And he attacked me many times. And people didn't believe me. Finally, and I don't talk about this very much. I might cry, so bear with me. I often wonder what role that played with my health, because it started in 4th grade. And I remember being tortured to a certain degree. And it's funny, when we do our high school reunions, we just had our 40th, we still have our support group of people who were hurt by this guy. He was evil. I think his parents were both very, very bad alcoholics. And I think he was born with fetal alcohol syndrome. He was just terrible. And I lost a lot of friends, because who wants to be walking with the girl who's having rocks thrown at her, or who's being chased, or who's being yelled at? And between 3rd grade and 4th grade, my life changed so badly. And I was so alone. I lost almost all of my friends. I didn't get invited to parties. I didn't get Valentines. There was a whole group of us. It wasn't just me. We have a famous bank president who was in this group. We were victims. We were victims. And it was so hard. And I wish back then that I had somebody to talk to. Because it affected my relationships with men. It was very, very hard for me to trust men. Even though I love men, and I'm heterosexual, and I love men, I had this extra layer of stuff to get over. And I can remember when I went away to college, he finally raped and murdered my neighbor. And I was on the phone, and they told me about it. And I just collapsed, because I knew that could have been me. It was so close to being me. So if I could go back in time, aside from giving him healthy parents and giving him the love that I think he needed, it would have been getting really good counseling. And I think that that's one reason why I got a degree in psychology, is trying to understand, the effects of that on the human body. So I had my first frequency urgency in 7th grade. This started in 4th grade. I had my first vulvodynia in high school. So I wonder, except see, the thing is that my mother has this, my sister has this, my grandmother had this. So did that stress cause this for me? No, it didn't. Did it make it much, much worse for me? Yes. Yes, it did. And there's a part of me that I look at my life, and I lost so much. I just really lost so much, when you guys were all getting married and having babies. I was at home with IBS and vulvodynia and just trying to get through the day. And again, if I could go back in time and change something, it would have been having a really good support group. Yeah, Angie says, fight or flight. You were in fight mode for so long. I was. Girl, you have no idea. Do I have PTSD? Absolutely. These tears show it. And I've got some friends who were victims who literally will not come back to my city because of it. He will not come back. One guy I just adore, so badly harmed by him. He literally will not set foot in the city. Ironically, I'm in the same neighborhood. In fact, his house is for sale right now. I mean, they only lived in that house for a couple of years. I can barely stand to go by that house because I know what evil lived in that house. So, we can't deny the influence of our childhood. And we can't deny the influence of what we have been exposed to. And this slide says childhood trauma, cognitive behavioral therapy. I never had that. And I needed that. I mean, I really, really needed that. I probably could do some of that today, shown by these tears. Thank you. But so a theme in my life is that I'm a fighter. I'm a fighter. Um, when I walk into a room, I don't look at the popular people. I look at the person sitting in the corner by themselves because that's how I was for so long. I am a champion for the outcast because I was outcast. Do I blame those kids? No, I don't. I would have done the same thing. And again, there's like 20 of us that this happened to. But so what that gave me, what got me through that, believe it or not, was John Denver lyrics. I just started listening to John Denver and I loved his songs and I could play the guitar and sing them. And I wrote them on my fabric purse in junior high. So I could just read them over and over and over again. And even now, Power Positive Thinking, I have affirmations I read over and over and over again. So that was really helpful. But then, the other thing that's just so interesting is then you encounter people who are abusive. So like when I was in high school, I was really serious. And, by that time, I was number one on the tennis team. And I was also part of the academic group, that really top. So I was doing okay on the outside. On the inside, I was still suffering. On the inside, I still felt very alone. And then when I went to college, I had a boss who was a terrible bully. Terrible bully. I've never met anybody so mean aside from the original guy. And that's when I woke up. And that's really, that's one of the moments when I went from being a victim to saying, oh, hell no. No, 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 no. You're never going to treat me that way. And I will walk out now if anyone is demeaning and insulting to me. Life is too short. I have already been through that. I am 58 years old. No one is going to mess with me that way again. And I actually did it with a nonprofit I was helping here in town a couple of months ago in their board. I was the chairman of their executive committee. And they were being so rude and so disrespectful to each other. I just stood up and I quit and I walked out. I said, I'm sorry. I'm not going to do that anymore. I'm done. I'm over. Life is too short. So I think what inspires me to do this is to remind us all that we deserve dignity and we deserve respect and we deserve comfort and we deserve love and we deserve kindness. And rather than taking the abuse, there comes a time when you've got to stop and say, no more. Now, granted, context is important. I don't want you to do it in a situation where somebody's abusive and all that sort of stuff. You know, you got to protect yourself. But I want you to put yourself first for once. You know, and Becky says, don't have regrets. I try not to have regrets. I'm very proud of the person I am now. I think I've done some really, really good things. I love my work. I love doing these streams. I love being a support group leader. I think I'm pretty good at it. I love people who tell me what I'm doing wrong so I can be better. And I don't think I could have done this if I hadn't gone through all that shit early on. You know, adversity makes you stronger. And I'm pretty damn strong and resilient now. But I grieve for the little girl. You know, I grieve for the little girl that I used to be. So you guys are great. Where does a support group leader go for support? Right here. I'm human too. And it's really, really important that I have a place where I can talk about things too. You know, and I'm not shy about it. I'll talk about anything from hemorrhoids to whatever. You got something you want to talk about? Hey man, I'm happy to. I'll research it for you. I'll see what I can do to find it. Also, to the 18-year-old, I got to say, I couldn't. You know. I remember getting really, really constipated, and I couldn't. I was too embarrassed to tell a doctor about that. Finally, I did, and it was just like, yeah, you know, don't be embarrassed about anything. And you know what? Listen, I'm just going to say right now that IC makes you stronger in the long run. You know how it makes you stronger? You will never, ever, ever walk away from someone in pain. You know what it's like to be alone. You don't want to be alone anymore. You don't want them to be alone in their suffering. If somebody that you love is hurt or an animal that you love is hurt, you're not going to sit back and let them suffer. You're going to do something about it. You're going to go hold their hand. You're going to get there to the doctor. You're going to be with them during recovery. You're going to drive them to the hospital. You're going to sit with them through surgery, as my sister did for me 2 years ago. You know, and I'm just going to say, if you hadn't gone through this, would you have been as sympathetic? Maybe not. I don't think I was. I don't think I would have been. Thank you, you guys. You're saying such sweet things. I really appreciate that. What a day. Boy, I didn't think I'd talk about that. Every now and then it comes out. All right. Any last questions? You can also occasionally, I mean, listen, true confessions, every now and then you can also see I have a tremor. I have an essential tremor in my neck. I inherited it from my dad and from my grandmother and grandfather. So you know if I get stressed, my head starts to go like this. That's my tremor. Don't freak out about it. It doesn't upset me at all. It just happens. Any last questions? Any last questions? Forever just came in. Support group meeting. We're getting close to the tail end. It's been about 2 hours and 15 minutes. All right, guys. So when Bladder Builder comes here on Wednesday, I'm going to do a live stream probably on Thursday. Although I have 2 appointments on Thursday. Oh, it's going to be hard. Anyway, I'm going to do a live stream this week to introduce Bladder Builder with the bottles. Barbara, Barbara. Barbara says, "How did you get so awesome?" You know what? I'm a stubborn bitch. Do you know that when I started the IC network, I had people telling me that I didn't know my place in the IC movement, that it was a stupid idea, that nobody would ever use the internet for support. I was yelled at. And you know what? My answer was real calm. It was like, hey, I have a hunch. I have a hunch. I think people are going to use the internet for support. I think people can use the internet for support in the middle of the night. And I actually offered the IC network to the ICA. And I got a lecture from them on knowing my place and what a stupid idea it was. And how they would never, ever, ever, ever acknowledge my work. And my answer back was, this is my doctoral dissertation proposal. I'd like to get that doctorate. And I have a strong feeling that online support is going to be the next generation. And I built it anyway. Took years of shit from it. Guys, it's a dark stream. I'm swearing. We call that a dark stream. And now the really interesting thing is that websites are now kind of the dinosaur of the internet. Now it's all about streaming. And so that's what you're going to be getting from me from this point forward, is a lot of streaming along with our magazine and stuff like that. So, well, listen, guys, it's been a, oh no, hopefully, I don't know if I'm going to save this video. I might delete this video from YouTube. I am not quite sure I want this one to be saved in perpetuity, to be quite honest. It didn't start well with all the Facebook drama, but anyway, you guys are awesome. Well, listen, so we'll be doing a stream this week to announce Bladder Builder. And then in 2 weeks, I'm going to be doing our weekly stream on Saturday rather than Sunday, because I've got a wedding shower to go to on Sunday, or bridal shower. Working on the new IC Optimus, doing some other stuff. I would really love your ideas. If anybody has a topic you want discussed, send it to me. If I can, I will research it. I will do an article on it if I can. If you have success stories that you want to share, please send it to me. Let's let everybody else out there know, and we'll go from there, okay? Because ultimately, in the end, none of us are alone. We've got each other. I know now that I'm not alone. I know now that I have guardian angels. I know now that there are people who will always stand with me. I didn't know that when I was a kid. I know that now, and I believe that some of you are some of those people. And I want you to think of me as one of those people for you too. If you ever get yourself in a bind and you don't know what to do next, I'm your girl. Call me. Call me if you can, send me an email, and we'll go from there. All right. You can find all my contact information over on the IC Network webpage, ic-network.com. All right, everybody. I'll see you later. Have a good one.